Dr. Praveen Vashist. He's a professor and officer in charge for community ophthalmology. He has a lot of work to his credit. He's really gone to grassroots. He's done a lot of work, and it's not only restricted to RPC. We've also had the fortune to work with him, the privilege to work with him. He'll be talking to us on the prevalence of avoidable visual impairment.
Chaitra, I hope my slides are visible.
Yes, sir.
Right.
Respected chairs and moderators, I've been asked to present a brief about the prevalence of blindness and visual impairment, specifically towards the avoidable blindness and visual impairment. And I'll be presenting some of the figures of the current National Blindness and Visual Impairment Survey, as well as National Diabetic Retinopathy Survey. In fact, this survey was conducted from the period 2015 to 2019. Survey was sponsored by National NPCB and it was conducted by RP Center all over the country in 31 districts representing 24 states. And we use this rapid assessment of avoidable blindness survey methodology, which is WHO certified methodology. The survey was conducted in 50 plus population and 93,000 people were covered all over the country under this survey. To give you the figures of blindness and visual impairment under this survey, the prevalence of blindness, which is defined as presenting visual acuity less than 3/60 in the better eye, it was 1.99%. Some other indicators were also assessed part of visual impairment, severe visual impairment, moderate visual impairment, and early visual impairment. All of them together are taken as visual impairment, which is 13.76%. Here, visual impairment is defined as visual acuity less than 6/18 in the better eye. And if we also add on early visual impairment, that is between less than 6/12 to 6/18, that overall make nearly 25% of the 50 plus population. 1/4 of the 50 plus population, they have some kind of visual impairment, taking cutoff of less than 6/12. If I present the trends of blindness in our country in last 20 years, in 2001, that was National Blindness Survey. At that time, prevalence was 5.3%. Here we have taken cutoff as less than 3/60. In 2007 National Blindness Survey, it was 3.6%, and currently it is 1.99%. So you can see that there's a significant reduction in prevalence of blindness in our country. But one thing which I would like to emphasize, that both blindness and visual impairment, all components, are comparatively much higher among women population compared to men. That means we are very clear, we need to give more emphasis towards the gender, the female genders in our country. This is the sequence of prevalence all over the country. As you can see, that the prevalence ranges between 1.08% in 50 plus population to up to more than 3%. It is 3.67% in Bijnor district in UP, taking total average of 1.99%. Not able to move my slide. Yeah. Again, if we see the causes of blindness in our country, the cataract still remain as the leading cause. In 2001 survey, it was 62%, and now we are getting 66%. So in a word, the total blindness has significantly reduced. Still, the cataract is the leading cause of blindness. And the second important cause which has emerged is the corneal opacity, the non-trachomatous corneal opacity, which is responsible for 7.4% blindness. If we compare with the 2001 survey, at that time it was just 0.9%. So less than 1% to 7.4% is a significant change in burden of corneal opacity as a blindness. And then at that time, refractive error was the second leading cause, but now it is just 0.1% of blindness due to refractive error, maybe due to change in definition refractive error. The other important cause which I would like to emphasize is the cataract surgical complication. It is the third leading cause at present in our country for blindness. So we are doing large number of cataract surgery, but it is also leading to more complications due to cataract surgery, and 7.2% of blindness is due to cataract surgeries. If we consider what is the proportion of avoidable blindness and visual impairment, you'll be surprised to know that 93% of the blindness and 96% of visual impairment is still avoidable in our country. So you can understand how much work we have to do at both at primary level as well as secondary and tertiary level in our country. And about uncorrected refractive error is the most common cause of visual impairment in general globally. In this survey, we found that nearly 11.5% of the people 50 plus age group, they have uncorrected refractive error, that is distant vision. And beside this, nearly three-fourths of the people 50 plus age group, they had uncorrected presbyopia. Again, it was higher among females compared to males. When we submitted this report, we were asked to give extrapolation for the prevalence of blindness and visual impairment in entire population and not only in 50 plus population. So we also conducted another survey on 0 to 49 age groups in a total population of 18,000. Same methodology, everything was same, but younger population was covered. And you can see the prevalence of blindness. Here, the most common cause in 0 to 49 age group is, it's not cataract. It is again non-trichomatous corneal opacity, which is responsible for 37% of blindness in 0 to 49 age group. And we have again assessed using both the figures for 0 to 49 group and 50 plus age group. And what we found that overall prevalence of blindness was 0.36% and overall prevalence of visual impairment was 2.55%. This in all age group. So you can see this was actually in 2013. The WHO came out with a program and the target was on visual impairment. That by the year 2019, we should reduce our visual impairment by 25%. And they have taken base as 2010. So WHO gave figures for all the countries, including India, for prevalence of visual impairment and blindness in 2010. We had 5.3% as visual impairment and 0.68% as blindness. As you can see, the visual impairment is reduced by 51.9% against the target of reducing it by 25%. It's a big achievement for our country that we have reached to a level of 2.55%. As far as blindness is concerned, the reduction of 47.3% in these 9 years from 0.68 to 0.36%. Now I would like to give some figures about National Diabetes and Diabetic Retinopathy Survey. Again, it was part of the National Blindness and Visual Impairment Survey. It was done in 50 plus population. We conducted in 21 districts all over the country, covering a population of 63,000. And again, in each district, it was 3,000 people were covered. And as you can see, the prevalence of diabetes, here we have taken a very crude method, that is random blood sugar of more than 200. You can understand 200 is quite high level. And still, what we have found that overall prevalence of diabetes was 11.8% in this 50 plus age group. As you can see, the prevalence was much higher in southern states in the country compared to north and central states in the country. In Thrissur in Kerala, it was 29.4%. In Goa, it was 24.7%. In Tamil Nadu, it was 21.2%. In Andhra Pradesh, it was 18.4%. Quite high prevalence of diabetes in southern states. Another important thing, in spite of taking this 200 as cutoff, nearly 1/3 of the people, they were not aware of their diabetic status. Known diabetes were in 67.3% and unknown newly diagnosed were 32.7% people in 50 plus age group. Again, we saw for glycemic control, 40% people, their blood sugar was not controlled. This is among the non-diabetics. And 40% of them, they had blood sugar level more than 200 milligram per deciliter. When we asked about treatment, most of them, they came out that they are taking some other tablets, but nearly 6% were not taking any treatment. And another 5.6% were taking insulin as treatment. But probably this is so important slide. The last retina examination, 90% of the people, they never had their retina examined. Probably this is the status in our country. It's a random sample covering both upper class and lower class. And only 10% of people, they have got their retina examined as per the history taken by us. And it is long-standing diabetes in many, many patients. You can understand the pathetic situation in our country. As far as prevalence of diabetic retinopathy is concerned, it was 16.9% among the diabetic patients. And even among them, we assessed for sight-threatening DR, it was 3.6% among all diabetics. So even sight-threatening DR is quite high. We also assess the blindness among all these diabetic people. Fortunately, the prevalence of blindness among diabetic was less than 1%. It was like almost equivalent to what there in other population. And the leading cause was not diabetic retinopathy. Leading cause among diabetic is again cataract is the leading cause of blindness. This is the prevalence of diabetic retinopathy state-wise. As you can again see that in South Indian states, the prevalence of DR is higher compared to North and Central Indian state. In the last, I would like to mention one slide about the recent indicators by WHO, and these are effective refractive coverage and effective cataract surgical coverage. These two indicators are actually taken as the key indicator for universal health coverage for every country. And we have a target of increasing the current cataract surgical coverage by 30% by the year 2030, and effective refractive coverage by 40% by 2030. I request that AIOS, Vision 2020, NPCB, they should try that. We should get at least baseline figures in all the districts in the country for these two indicators, as well as we'll try to achieve the targets by 2030. Thank you very much. Thank you.